Avascular necrosis. Avascular necrosis. A disease that results from the temporary or permanent loss of blood supply to the bone. Untreated. It worsens with time and eventually, the bone can collapse. It also causes bone to lose its smooth shape, potentially leading to severe arthritis. Symptoms. Minimal early joint pain. Increased joint pain as bone and joint begin to collapse. Limited range of motion due to pain. Causes. Injury. Joint or bone trauma, e.g. fracture, dislocated joint. Damage to blood vessels. Fatty deposits in blood vessels. Block small blood vessels, reducing the blood flow that feeds bones. Long-term use of steroids, e.g. corticosteroids. Corticosteroids tend to both reduce the body's ability to absorb calcium and increase how fast bone is broken down. The more and the longer to take, the greater the risk of developing osteoporosis. Long-term use of alcohol. Heavy alcohol consumption compromises bone health and increases the risk of osteoporosis. It decreases bone density and weakens bone's mechanical properties. Risk factors. Gaucher disease diminishes blood flow to bone. Missing of an enzyme that breaks down lipids. Lipids start to build up in certain organs such as spleen and liver. Blood disorders, e.g. sickle cell anemia, diminishes blood flow to bone. Hypercoagulable state, hyperlipidemia, decreases in WNT signaling and PTH responsiveness, insulin resistance, and increased rankle, resulting in decreased osteoblast activity and increased osteoclast activity, ultimately contributing to poor skeletal health. Diabetes, diabetic neuropathy, nerve damage, arterial disease, and obesity may contribute to changes in bone metabolism and impaired bone microarchitecture. Pancreatitis increases low bone density due to malabsorption of vitamin D and calcium. Decompression sickness, Kyson disease. During decompression, gas dissolved in the arterial blood comes out of solution and can form arterial gas emboli. Gas bubble formation can lead to endothelial disruption and subsequent vascular occlusion via coagulation of intraosseous microcirculation. This leads to venous thrombosis, causing retrograde arterial flow and increasing the overall intraosseous pressure. It can cause dysbaric osteonecrosis. Radiotherapy develops bone loss. It is often delayed for several years. That's why screening and follow-up care are important for maintaining healthy bones. Chemotherapy, autoimmune disease, e.g. systemic lupus erythematosus, HIV, AIDS. Smoking. Treatment designed to improve functionality and stop further damage to the bone or joint. Medicines control pain. Assistive devices reduce weight on the bone or joint. Core decompression, surgical drilling into the area of dead bone near the joint to reduce pressure and allow for increased blood flow, that slows or stops bone and/or joint destruction. It is commonly performed for osteonecrosis. Osteotomy reshapes the bone and reduces stress on the affected area. Bone graft. Healthy bone is transplanted from another part of the body into the affected area. Joint replacement. Surgical procedure to remove and replace an arthritic or damaged joint with an artificial joint. Electrical stimulation and combination therapies promote bone growth.